Hey, what's up, you guys? It's Noah, and today I want to talk about my top surgery consultation that I had yesterday. No, the day before. I had it on Monday, and I had it with Van Loenen. She is a surgeon here in Amsterdam at the Slotervaart hospital, and she's known as one of the best in the Netherlands. Her results are really, really good. And I just want to talk about how that went and what I can do with my chest. So, I went there with my mom and dad. I was supposed to go with my mom and dad, but I fucked up on the communication part. So I told my mom it was later that day, and it wasn't. So my dad was luckily already here, so we could just go together. And then my mom joined us later, and that was all good. Anyways, I went there with my dad. We were a bit early, and she was like, oh yeah, I have time right now, so if you want to come in now, you can just have the appointment now. So I don't know, so I had the appointment 20 minutes earlier than expected, which was nice. So we just sat down and we went straight into it. There wasn't much introduction or whatever. It was like, okay, she just pulled up the presentation and she went through various kinds of results and also different methods. And I know all of them pretty much. The only difference is that different surgeons have different results, and hers are really good. Yeah, she told me that depending on how big your chest is and also how much they hang and on the quality of your skin, that determines which type of top surgery you can get. So it's not just like bra size or whatever, it's also like how much they hang, because if they hang too much, then you are more likely to get double incision. And if you have very loose skin, then it's better to have double incision as well, or a different type of surgery. So we went through the whole thing. We also talked about how the day of surgery is going to look like, and I will be there 24 hours in the hospital after my surgery. She said that most things that can go wrong will go wrong in the 24 hours. So if you need some kind of revision, it's within those 24 hours, she's gonna be there, and then afterwards I can go home, and I'm gonna go home with my parents, or maybe first with my dad and then with my mom, because they're divorced. And I will stay home for 2 weeks, I think, and after 6 weeks I can do all of the activities again. I can do sports, whatever. Anything else she talked about? We had a lot of questions. Most of the stuff was already explained in the presentation, but I had some questions about going abroad and needing a revision in the Netherlands. And it's funny when you ask surgeons about that, because it kind of hurts their pride, which I understand, because you go abroad because you think abroad the results are better, but then when they fuck up, they can clean up the mess, which I understand. But at the same time, this is not just I'm not getting a nose job or whatever, it's not just aesthetics, it's more than that. I need to be happy with my chest for the rest of my life, and if I know I can do that somewhere else, which is gonna make me happier and not regret the decision that I made, then I'd rather go abroad. And if something goes wrong, I don't know, I think it's I respect them so much, and I respect their work, but it's also it's gonna be my chest for the rest of my life. So if that hurts your pride, then I'm sorry, but I'm still gonna do it. And she was they're not gonna be pleased to see you if you come in and you want a revision or something. Anyways, so we talked about that for a little bit, and if you want to get surgery abroad, then you can still get a revision here in the Netherlands. That was the bottom line of that conversation. My dad, he's 100% supportive, you have to know, but he asked just in case, what if he changes his mind, will he be able to reverse, will he be able to get tits again? And she's well, I worked as a surgeon since 2005, and last year I had 100 patients here, and in all that time I think she had 3 to 5 people, I can't really remember, but I think it was 3 people that regretted their decision, and she had 1 person who was actually also getting breast implants now. And she talked about that person for a little bit and said it was this person wasn't doing mentally very well. So yeah, she was kind of you have to, if you ever go to her consultation, or if you think of if you want her as a surgeon, like, she's pretty down to earth, and you know, she's not a therapist. Don't expect a therapist, but she's just funny, you know, like a very dry sense of humor. I like it a lot. The way she was talking about this person was just really funny, I have to say. Anyways, yeah, so she's cool. And yeah, after that, after the questions and shit, she said, like, to my dad, like, okay, so could you please leave the room, because now I'm gonna look at his chest. And so I took off my binder, and the weird thing is, like, last week I had to do I had to take pictures of my back, because I have some back problems for a couple of months now, and I felt so uncomfortable doing it. But at her office I felt totally fine. Because I think it's just a different reason why you're there, right? And I know she's supportive, and I know it's like what she's doing, and she sees me for the guy that I am. You know, it's a weird thing, because I was not, like, very uncomfortable taking off my shirt and my binder, and she just took one look and said, "Oh, I can do donut with you, or keyhole, or periole, or whatever you want to call it." And I was like, what? Huh? I didn't expect that at all, because I thought that, like, I don't have a lot, but it's also, like, from what I've seen from pictures of other guys that got periolar, it's not that small, but it's also not super big. Like, it's, you know, and it is smaller than it used to be. But she said, like, yeah, I can do donuts. So I was, like, totally, like, surprised, and I was like, holy shit, like, what do I do now? Because in my head I was already preparing for double incision, and, you know, embracing the way that's gonna be on my body, and yeah, and I was also looking forward to it. And then she's like, no, you can do donuts. So I was like, whoa, I have to think about this, because the thing is, and that's my dilemma, and that's actually what I want to talk about. Because so if you do donut or periolar, my concerns are that it can look a bit saggy, like there's too much skin for what's underneath, you know. So it looks like you lost a lot of weight, for example. You can maybe compare to that. I just compare it to a deflated balloon, and I don't really like that. I would feel super self-conscious in public if I would take off my shirt. But the thing is, within a year, and if you work out a lot, then, you know, it looks really good, actually, and her results are really good as well. So yeah, that's, like, my concern with that one. Also, for double incision, like, on the other end, if you take double incision, it's like your chest is flat, like really flat, and it really is tight around your muscles, which I really like. And also, yeah, I don't know, it's gonna it sounds weird, but I was kind of looking forward to have these scars also, because I'm proud of, you know, not that I'm not proud of, like, how I was born. I'm proud of how I've dealt with how I was born, and that I'm doing all this stuff mostly by myself, you know. And yeah, that's just something, I don't know, it was something symbolic for me, or something to be proud about. And I can still be proud, of course, with donut, that's not the thing, but it's like, I don't know, it's, you know, they're kind of like battle scars. But the thing is, I also know that if I would do double incision, then if I was going to travel somewhere, and, you know, maybe I would be in a dorm and take off my shirt, and with double incision I would feel very self-conscious, and people would probably ask questions. If I had donut, then you probably wouldn't even see it, you know. So in that way I can be invisible and explain, or, you know, tell people that I'm trans if I want to, whenever I want, not whenever I take off my shirt. Yeah, so that's the thing. But I also think, like, around my friends here and my queer friends, like, I would feel proud to have these scars, but I would also feel proud to have donut. So, but I have to think in the long term. Like, I know the symbolic meaning of double incision is, for me, was a bit bigger, but if I think about it in the long run, then I probably want to have donut. Like, yeah, definitely. If it's done well, then I would definitely go for donut, and she has some really good results. Yeah, so I think I'm gonna go for donut. 90% sure. And also the thing is, if you get donut, you can still go from donut to double incision if somehow it's messed up. And I don't think she will, because she's really good. But yeah, you can still go for double incision. So those are my thoughts. Cannot focus on my schoolwork right now because I have to decide about this. And she's gonna call me in 2 weeks just to discuss it, and then she'll ask me on which waiting list I'll be on. I can probably get the surgery around September, October, but the waiting list for periolar or donut is a bit longer, she said, so I have to ask her. Also, the positive thing about donut is that I have to think less about being trans, which is really nice, because when I feel self-conscious maybe in the future, then I won't be reminded that I'm trans if I look down that much. And I know it, yeah, and that's something personal, I think. I have to say, like, I know that I am, like, I'm privileged to even get to choose between the two. I should say that, because I don't want to hurt anyone or piss anyone off, because not everyone can choose. Yeah, it's just a bit difficult, just being able to choose. I wish she would just like, okay, you're gonna get this, and I could just accept it and, you know, live towards the day that I'm gonna get top surgery. It's easier when people take decisions for you, and I have to do that myself, and I have to live with the consequences. And that's also the thing that I'm scared about. Like, I wish I knew how my chest was gonna look like, you know, a year from now. But I just can't. Like, whatever procedure I get, it's just unknown. Like, she doesn't know, I do not know, nobody knows. And that's something I just have to accept, and I just have to trust my surgeon. And I think I do. Also, I don't know if you knew, but I was thinking about going abroad before, just because especially with double incision, the results abroad were, I think, a bit better than the ones in the Netherlands. That's my opinion. You can be super happy about the Dutch version of double incision. I was thinking about going abroad, but now that I know I can get donut, and also know that my chest is so small that it would, if I would get double incision, it would be a straight line and go up a little bit, which is exactly what I wanted for double incision anyways. So, and it's less of a hassle if I do it here, and it's for free, which is awesome. I'm also very, very lucky with that. So, yeah. Anyways, that's my ramble. Hope you enjoyed this. So now here's the question for you, and also ask this on Instagram, but if you had the choice, would you go for Peri or would you go for double incision? Let me know in the comments down below what you think. Also, make sure to follow me on Instagram, and yeah, I'll see you soon with the next video. I'm getting into YouTube again, I like it. So if you have any video ideas or suggestions, leave them down below as well, and I hope to see you all next time. Later.